A 46-year-old woman arrives at the hospital with a persistent headache that has lasted for 15 days. She walks to the registration desk, where the staff greets her and completes her registration. Before meeting the doctor, she is directed to the nursing station for her initial clinical assessment. The nurse records her medical history and notes that she has asthma and is not taking any medications at the moment. Her vital signs are checked carefully. Her blood pressure is 162/102. Her random blood sugar is 286. Her temperature, pulse, height, weight, and other key health parameters are also measured. All of this information is entered into the next-gen hospital management system, which is integrated with the All India Institute of Medical Sciences Clinical Decision Support System. The patient then meets the doctor. The doctor reviews her details and opens the CDSS tool for evidence-based recommendations. In real time, the CDSS analyzes her data and generates personalized clinical guidance. For hypertension, the CDSS suggests adding a calcium channel blocker, such as amlodipine 5 mg, S-amlodipine 2.5 mg, or cilnidipine 5 mg. It also highlights that beta blockers are contraindicated for this patient. For diabetes, the CDSS recommends adding a biguanide, specifically metformin 1000 mg. With these digital insights, the doctor creates a precise, evidence-based, and personalized treatment plan quickly and efficiently.